World, makers of film and television are struggling to work out whether and how they might continue. I've been talking to the creator of Line of Duty, Jed Mercurio, and its star Vicky McClure, both also involved in a new charity push for protective gear for the NHS. Later on, we'll hear a cultural response to this and earlier plagues from the poet laureate, Simon Armitage. But first, our news review today comes from the BBC's health editor Hugh Pym and the former Home Secretary who resigned from Boris Johnson's government before anyone had heard of COVID-19, Amber Rudd. Lots to think about, lots to talk about. But first, the news with Rachel Burden.
Thanks, Andrew. Good morning. Boris Johnson has acknowledged that the new lockdown guidelines for England are more complicated than his previous message to stay at home. Writing in the Mail on Sunday, the Prime Minister says he understands that people will feel frustrated with the new rules, which he announced a week ago. He's thanked the public for sticking with the government and says he trusts in what he calls the good sense of the British people. Sir Keir Starmer has called for a more united approach in the way the 4 UK nations tackle coronavirus. The Labour leader blamed the Prime Minister for the way Wales and England had diverged in the easing of lockdown. He claims Boris Johnson failed to get his ducks in a row before announcing his plans last Sunday. The government says there are far more similarities than differences in the approaches of the UK nations. The government's investing £93 million to accelerate the construction of a new vaccine manufacturing centre in Oxford. The facility would be able to produce enough vaccine doses for the UK population in 6 months. But the Prime Minister has warned a vaccine might not come to fruition. The head of one of England's largest academy trusts has told the BBC it would be pointless to delay the return of children to school until September. John Coles from United Learning said a gradual reopening had to begin, but warned the government's target of bringing all primary children back in the summer term was unrealistic. Yesterday, the Education Secretary said it would be a cautious, phased return. Teachers' unions say the plans to get some children back in the classroom in 2 weeks are unsafe. Barack Obama has launched another attack on Donald Trump's handling of the coronavirus pandemic. The former US president said many officials aren't even pretending to be in charge. Mr. Trump has accused his predecessor of trying to undermine his presidency. The UK's super rich have lost more than £54 billion in the past 2 months because of the COVID-19 pandemic. That's according to the annual Sunday Times Rich List. The inventor, Sir James Dyson, best known for his vacuum cleaner, tops the list for the first time. He's now worth over £16 billion. And there's a record 25 female billionaires on this year's list as well. That's all from me. The next news is on BBC One at 1 o'clock. Back to you, Andrew.
Very many thanks, Rachel. And now, as ever, to the front pages of the newspapers. The Sunday Telegraph has an interesting story here saying that drugs which thin the blood can help prevent virus deaths. I'll be talking to Hugh Pym about that in a moment. The Observer is talking about a revolt over the easing of lockdown. That's in the northern cities of England, and a poll slump. Public approval of the government's behaviour over the coronavirus crisis has fallen quite dramatically, it says. The Mail on Sunday, now it's doctors at war on schools. The fight between the teaching unions and the government about when to reopen schools is all over the press. The Sunday Times there, it's got its rich list, of course, as it does every time this year. Super rich lose billions to virus. You heard that on the news. I'm sure lots of people up and down the country will be racked with sorrow about that. And there's the Sunday Express finally. Britain on fast track to virus recovery, it says. Let's hope they are right. Hugh, blood thinners. This does seem like a very important development.
Yes, Andrew, it's a very good example of the pace at which science and medical research is having to move because of coronavirus. Research has shown that people in intensive care with the virus can, up to a third of them, have blood clotting. That association, particularly blood clots in the lungs, has proved very interesting to scientists. So at the Royal Brompton Hospital in London, they've done some research on this, and it's seen as a very good example of collaborations. And NHS England, as it happens, are sending out guidance to doctors to try blood-thinning drugs to see if that makes any difference. Again, the pace at which all this is moving is interesting and challenging, yes, and exciting, really.
Yes, just while I've got you here, Hugh, I've also read this week that there's lots of interest in possible long-term complications after you've recovered from COVID-19, but even if you're a younger person, including scarring on the lungs and so on.
Yes, scarring on the lungs, and it's becoming clear that if you've been in intensive care and have come through this, it takes a very, very long time to get back to a full state of recovery. It can have an impact on on your mental health as well as your physical health. So certainly there are long-term consequences if you pull through coronavirus.
Amber Rudd, we've been hearing across the press today about the big fight between the teaching unions and ministers and former education secretaries about when schools restart. Just talk us through what's going on.
Well, I think that the earlier conversation you just had with Hugh is so instructive. Everybody's looking for certainty about when they can feel safe, certainty about how infectious children may or may not be to adults, what underlying risks are going to take place at school, all these things which just aren't available. The phrase we used to use the whole time when this first started was unprecedented. And I think we have to remind ourselves we are still there. So at the moment, we've got this division where the teaching union is saying we're not prepared to allow our teachers to go back to school yet. Although we want them to go back, we need to be safe. But in fact, they have to go back. They have to go back because we need to make sure that our children go back, and that all the issues to do not just with education, but also to do with security and safety, mental health issues, safeguarding, those children need to go back to school. So the teachers are being asked to reopen the schools, to reopen them in a phased approach, as the Secretary of State for Education has said, and I hope they will do that.
Is it fair to say this is becoming a fairly intensely political argument between the unions and the government? Some people on the government side think this is a political attack on them.
Well, it does feel like it, I must say. The teachers I've spoken to have said, yes, they want to go back to school. But of course, they're cautious about making that commitment unless they can somehow get a commitment that the schools are safe. And, you know, they can only go so far with being 100% sure. There's too much that is unknown about this virus. But I do think it's interesting that several former education secretaries, and I'm looking particularly at the article by David Blunkett in the Mail on Sunday, have resoundingly come out supporting the government, saying these teachers need to go back to school in order to help our children. Leaving the children outside of schools for any longer is going to do lasting damage.
And yet, as you said, the teachers themselves want to go back, and the real question is, can they possibly be safe in an environment with lots and lots of kids unable or unwilling to socially distance day after day after day? You can see why they're really worried.
You can see why they're worried, which is why it's right to have a phased approach, why we're right to have a look at how the best way of imposing some sort of security for the teachers is. But at the same time, we all know that social distancing in a primary school is fairly imaginary. So there's got to be as much reassurance as possible, but this can't go on any longer.
Hugh, let me turn back to you for a second. The R number. We talk about the R number day after day after day on the telly, and it's all over the newspapers. But the Sunday Times is a rather interesting piece asking the basic question, is it reliable?
Yes, the R number is extremely important. Just as a quick reminder, it's the reproduction number. If it's below 1, it means that 10 people are infecting fewer than 10, so the virus will eventually fade away. If it's above 1, it goes the other way and the epidemic starts accelerating again. Now, the estimate as of last weekend was between 0.5 and 0.9. It's always a range, but on Friday, it nudged up to between 0.7 and 1. Now, that sounds as if it's suddenly become slightly more serious, but it reflects back to data before last weekend, before the beginning of the easing of restrictions in England. And I think this is the problem. You're linking it back to historic data on infections and hospital admissions sometimes.
So that means ministers are having to take big policy decisions based on information they know maybe 3 or 4 weeks out of date.
Yes, in fact, there's an analogy in the Sunday Times piece saying it's a bit like marbles on a table in a dinghy in a typhoon, trying to predict which way they're going to go. That being said, officials are saying data will get better as we go on with more testing, more widespread information about how rapidly the virus is spreading. So I think it'll become easier to do this modelling as testing continues.
And to remind people at home, this is very, very important because it depends on when the great unlocking finally happens. The Sun is pretty sure it knows the date.
Yes, the Sun are talking about Independence Day sometime in July and a return to normality. Well, if that's going to happen, it does depend on this R number to a large extent because ministers have said that's what they're going to be watching week by week. It's going to be published every week, and they've also let it be known if it starts going up above 1 in a significant way, some of the restrictions may have to be tightened again.
And in London, for instance, there was a front page headline earlier in the week about the R number being down to 0.4, as if the basically London had beaten this epidemic, but it's probably too early to say.
Well, there are regional differences with and the northeast of England, it was a bit higher. That leads to the possibility of a different type of policy in different parts of the country. Although I think that the problem with these different estimates is they are estimates and ranges, and they may change as time goes on.
Indeed they may. Amber Rudd, former Home Secretary yourself, an extraordinary story in the Sunday Times about the police going and knocking on doors in London and asking Crims or former Crims to stop being Crims, politely and nicely.
Yes, love that piece. Of course, the police have effectively, they know where people are now, so they can go and knock on their door and have a chat. And I particularly like reference in the article to the personal letters that they've written for these criminals. They've gone in, they've chatted to them, and then they've left them a letter reinforcing the need to think about other ways of, shall we say, developing their future. I think it's a very encouraging piece. It's nice to think that the police are taking advantage of people being at home in a way to try and really hone in on the criminals, the serial criminals. And I think, if I may, just on police, there's also a very good picture on the front page of the Telegraph of the police who were in Hyde Park yesterday, potentially arresting a rather small group of people who are protesting against lockdown. And it's just a reminder, if I may say, of the great work that the police do without too much PPE themselves. All they're wearing is some blue gloves to protect themselves while they go about doing the incredible job that they've been doing. So I think the police have been really supportive and effective, even though during this period it's been quite confusing for them in many ways in terms of what they can and can't enforce.
Let's talk about the work of ministers, if we could, because we've got this new hub and spoke system, a reorganisation of government, we're told, and policy now in far fewer hands at the centre of government. But many of us have noticed that none of those hands are female hands. Do you think that matters?
Yes, I've always thought it matters. The point is, if you want to have a government that really represents all the talents and thinks about everybody, you've got to make sure that the people at the top are like that as well. And we hear a lot from Number 10, and particularly from Dominic Cummings in the past, about wanting to make sure that we have a diverse talent at the top of government. Well, I would start by making sure there are some women at the top. Not only is the top 4 all male, the head of the civil service, of course, and the senior posts are generally held by men. And I really think that the Prime Minister needs to do something about that. And it's not, if I may say, because I often get a fair amount of criticism for this, it's not about the so-called optics, it's about good government. Good government, like good governance for business, we've always encouraged businesses to have women at the top as well, involves having women to help with decision making. I think this government would be making better decisions if it incorporated some women at the top.
And very quickly, you know Boris Johnson well. It seems he's had something of a Damascene conversion about the nanny state as a result of having COVID-19 himself and being told that he is overweight. Is that the kind of thing that we can try? I mean, we read about it in the papers. Would you believe that?
Yes, I would believe that. I mean, I think it's inevitable, isn't it? I mean, we all get affected by our own illnesses, and there's nothing like a brush with death to make one really rethink your own health and the consequences perhaps to other people. I've sat in cabinets with Conservatives before where health secretaries have tried again and again to introduce some sort of obesity limit in terms of product or in terms of exercise, and it's always pushed back a bit from fellow Conservative Secretaries of State. But I hope that that's over, and that with his own experience he'll be able to spearhead a real change.
Amber Rudd, Hugh Pym, thanks both very much indeed. As the Prime Minister himself says, apparently, don't be a fatty in your 50s. And with that thought, so to the weather. Pretty warm. I think a fair and meteorologically accurate estimate would be a bit of this and a bit of that. Over to Chris Fawkes in the weather studio. Chris.
Indeed, Andrew. Yes, I'll fill out the details with the this and that's of the forecast. And actually, it's going to get much hotter as we head towards the middle part of the week. The hottest weather we've seen so far this year, with the peak of the heat coming on Wednesday, with temperatures forecast to reach 27 Celsius into the early 80s in Fahrenheit. Today, though, it's not that hot. For England and Wales, we've got some sunshine. We'll feel quite warm in the sunshine here. Northern Ireland, the rain easing off for a time before coming back later this afternoon. And for Scotland, brightening up today across the north and east as we go through the afternoon. 16 degrees in Aberdeen, up to 20 in Norwich and in London as well. Now, overnight tonight, rain returns to Northern Ireland. It becomes quite heavy here and then moves into Scotland, across northern England, and perhaps some splashes of rain getting in across Wales and the Midlands for a time too. The south stays dry, and it's going to be a much milder night compared with recent nights. temperatures between around 8 and 11 degrees. Tomorrow's weather. Well, we've got cloud again across northern areas of the UK with rain at times. Could see some of that rain getting into northern England, Wales and the Midlands, but the south of Wales, the south of England and East Anglia stay dry. It starts to warm up, 24 degrees Celsius, the top temperature towards the southeast, warming up as well in eastern Scotland with highs of 18 in Aberdeen. But it's on Wednesday that we're likely to see the driest, sunniest weather nationwide, really. That's the latest forecast. Andrew.
Look forward to Wednesday. Thanks very much. Now then, nothing is certain, but every scrap of data we're reading at the moment suggests that we are living through the mother of all recessions, possibly the deepest for 300 years. And with millions of us relying on state support, borrowing this year is set to dwarf even what we saw during the financial crisis. What does this all mean for our future economy and our future prospects? Let me ask the man in charge of marking the government's economic figures. Robert Chote is chairman of the Independent Office for Budget Responsibility, and he joins me now. Welcome, Mr. Chote. Can I ask you, first of all, very simple question. People see these predictions, worst for 300 years, etc., etc., etc. How worried should people be themselves?
Well, the key worry is if you have not just a very sharp downturn in the economy, but one that scars its future potential. So people shouldn't panic in the sense that we know that the economy, probably at its worst last month, may have been a third or so smaller than it normally would have been in terms of the output of goods and services and people's spending. But that should be the worst of it, and we now go into a period of recovery as the restrictions are loosened. So the key issues in terms of how bad this feels and the impact for the public finances are how swift that recovery is and whether the economy is permanently scarred at the end of it, i.e. we come out of this with the economy being smaller than we would have anticipated going in. That's a bigger question than exactly how deep it is at the worst point.
Yes. There's a whole alphabet of possible shapes of recovery, a U-shaped recovery, an L-shaped recovery, which is no recovery at all. But you have said at the OBR you're hoping for a V-shaped recovery, quite a quick bounce back, and we'll be back to where we were by the end of next year. Is that possibly a little bit optimistic?
Well, that was basically an illustrative scenario to show the channels through which the hit to the economy would affect the public finances, which is roughly speaking that if you disrupt the economy, you lose tax revenues, and the government's policy response is pushing up spending, and both of those things push up borrowing. In practice, I think you're likely not to see the economy bouncing back to where we would have expected it otherwise to be by the end of the year, which is part of that assumption, but instead a rather slower recovery. And that will depend first on the pace at which public health restrictions are loosened, but also, of course, on the way in which people's behaviour responds. So if you allow people back into the workplace, back into shops, back into restaurants, will they actually go? Will they feel too nervous? So you would expect, I think, a slower recovery than the V shape that you simply make for that assumption.
So this is all based, as you say, on people's behaviour and guessing it ahead of time. It is perfectly possible that after this, people will not go out and spend in the way that economists hope they will.
Well, we have to wait and see. As you say, it's a matter of psychology as much as the concrete restrictions as well. We're also going to go through a period, I think, in which businesses are going to come out of this feeling the need to restructure the way in which they work, not simply to deal with a new temporary normal, hopefully, of greater social restriction, but also adjusting for the longer term. You would expect, for example, I think coming out of this, that more sales are going to be done online than you would previously have expected going into this. And will we have the same size restaurant or retail sector that we went in? So there's businesses and individuals as well that have to adjust to this.
You used what I thought was a very interesting word a moment ago. I think the Governor of the Bank of England has used the same word when he's talked about scarring of the economy. In other words, that we come out of this not just with a smaller economy, but also a differently shaped economy. What's your research showing on how different the economy might be after COVID-19? Will there be sectors that have vanished completely and new sectors blooming in their place?
I think you can certainly see those sorts of adjustments, as I said. I mean, imagine, do you think that the restaurant sector is going to be the same size coming out of this as you went in? When we talk about scarring, we're basically talking about whether the short-term hit to the economy has permanent or at least very long-lasting consequences. And that can arise for three main reasons. We have a period in which some business investment will have been lost or cancelled. You also may have some businesses failing, part of that restructuring process you described, and also that some people who may have been furloughed and go then into unemployment find it harder to get back into the labour market. So all the government's policy measures and the Bank of England as well, by trying to support people's and businesses' incomes and to help them finance themselves through this, are designed entirely to try to minimise that scarring, which is also important for the future of the public finances as well.
Future of the high street?
Well, it's, as I say, you can imagine that there's a whole lot of decisions that people are going to have to take coming out of this in terms of what the right business structure is. Have they got the right number of outlets? How can you operate them on that sort of basis? So not just the high street, but I think a whole variety of sectors are going to need to be thinking about what business looks like in either the new normal or at least a sort of quite extended period of normal before we get there.
At the beginning of the interview, I mentioned that a huge amount of government debt hanging on the shoulders of the state, £300 billion or more. Can I ask you, is it possible going forward to sustain that level of debt without cutting spending or raising taxes or doing something like that?
Well, there's a distinction here between the stock of debt and the amount you're borrowing in any given year. So we're certainly going to see temporarily a considerably higher amount of government borrowing. We'll get the first figures for April on that later this week. The fact that the level of debt goes up on its own doesn't necessarily mean that you have to have the sort of austerity that followed the financial crisis. Much more important to that is whether you have this effect of the scarring of the economy, and if the economy is permanently smaller, then you get permanently less tax revenue, for example. Do we come out of this with a much bigger debt interest bill? At the moment, it's relatively cheap for the government to borrow, so hopefully that won't be too much of a problem. And then there'll also be political choices coming out of this. Do we want to spend a higher proportion of national income than we went in, for example, on health and social care? So all of those things together will shape the fiscal challenge for the government coming out of this. But a post-financial crisis style extended period of austerity is not a done deal.
And the Prime Minister has already told Tory MPs he doesn't want to do it either. But can I ask, this is a government with big ambitious ideas about more public spending, particularly in the Midlands and the north of England. Is that going to be sustainable given the level of debt we already have?
Well, as I say, I think it depends very much on what level of government borrowing, the ongoing amount, the ongoing gap between spending and receipts that you have. So the government's obviously going to have to put in place at some point a new set of spending plans. In the budget, it seems like a lifetime ago back in March, it put down some much more ambitious plans for capital spending. So it'll need to look at that. It'll need to look at whether you want to do more day-to-day spending in some areas of public services. And then, of course, if the consequences of that for government borrowing, the government decides are unacceptable, then there's always the option of looking at tax increases as well.
Robert Chote, thanks very much indeed for talking to us this morning. Line of Duty, the police thriller, has been one of the BBC's most popular dramas. Work on the series was beginning when coronavirus struck and brought it to a sudden halt. I've been talking to one of its stars, Vicky McClure, and to its creator and writer, Jed Mercurio. They're both involved in Asks for Masks, which raises funds for health workers. Viewers can bid for items on an online auction, including some donated by celebrities. Here is a brief clip of life inside AC12 right now to explain.
Yeah, that's the ticket. Now, about this coded message we received. Steve.
Gaffer.
Where are you, son?
I'm at AC12, sir. Working on a case.
Oh, you're a waste. Do you think I come up the lagging in a bubble?
This is a virtual background, sir.
Right, well, all right then, but it better not be coming out of the AC12 budget.
Vicky, let's start with you. Whose idea was it to revive the characters for this promo?
That'd be Jed. He got in touch with us to see if we was up for doing it, which we definitely was. It's for a great cause. And yeah, we were glad to get back into character, into costume, albeit Martin's wasn't quite there. But yeah, it was great fun.
Jed, I know you were a hospital doctor before you picked up the keyboard and became a writer. What was the genesis of Asks for Masks and how does it work?
Well, that actually came from contacts through my former life as a hospital doctor. And they got in touch because they wanted people to help publicise their campaign for a better supply of PPE for frontline healthcare workers. and we were delighted to help and support with the video and get the word out.
Vicky, I know that you were 4 weeks into filming Line of Duty when the virus struck and everything had to stop. That must have been a big blow.
Yeah, it was. It was kind of strange because we was on set and obviously a lot was unfolding. And I think we all knew that we was, not far off having to shut down. And we did when it was the right time to do it. It's a massive blow for everybody, no matter what business you're in. It's tough to not have to go to work when that's, what we naturally do. So we'll get back up and running as and when it's safe, I imagine.
Jed, everyone in the television industry is asking themselves about how they're going to be able to carry on, or if they're going to be able to carry on. How confident are you that you're going to be able to return to filming Line of Duty this year?
I think it's still something that's in doubt. A lot of people are working very hard on coming up with codes of practice within the TV industry. But the reasons that we shut down were related to what was going on in wider society. We had a small outbreak earlier on in our shoot. And because at that time there was the public health infrastructure providing test, trace and isolate, we were able to contain it and carry on. The problem was when that was abandoned by the government, we then were looking at a situation where we couldn't apply that. So to be honest with you, there's a lot we can do within the industry, but until wider society has the public health infrastructure of test, trace and isolate in place, it's going to be very hard for anyone.
So testing and tracing would, in your view, allow television and film and other creative industries to restart again if it was done properly?
I think it'd be one very important element of it, and the reason for that is that we can't make productions in a bubble. The cast and crew will go home, they'll come into contact with other people, they'll be interacting with the rest of society. We have guest artists come on, crew interacting on and off set. I just don't think, unless wider society has got the process right, we'll be able to work in isolation.
So it sounds to me like Line of Duty won't be coming back this autumn at any rate. Can I ask whether when it does come back, whether you're going to have to rewrite your plot lines given this extraordinary event that's happened to all of us?
I think that's a great question, and we're all considering that. The fact is that we shot for 4 weeks in a pre-lockdown, pre-COVID world, and all that material would have to be reshot if we were going to change things. So it's something that has huge cost implications, but we are discussing it.
Are you raring to get back, Vicky?
I am, yeah, even if it means reshooting what we've already shot. Yeah, of course. I mean, I'm quite bored, as I think a lot of people are, but we just can't rush it. Nobody knows how this is going to unfold, and we've just got to make sure everybody's safe. I feel for a lot of the crew. It's a difficult time when you're out of work. So yeah, I want to get back as soon as we can, but that's got to be when it's safe. And we're not a show that is similar to the soaps where there's a possibility of bringing the actual subject of corona into the storyline, where that could make it slightly easier for them to adapt to it, whereas it's currently not in Line of Duty's world. So
it certainly isn't. You are yourself in a new Amazon thriller series based on the Anthony Horowitz novels, the Alex Rider novels, I think, for young or teenagers, basically. Just tell us a little bit about that.
Yeah, no, it's I think it's good timing for it to come out. It's based on the story on the book. So if anybody's read the books, then it's something that should excite them. It's aimed at a younger audience, and I think with the kids being off school, hopefully it'll give them something to escape in, and they can binge watch it on Amazon. It starts on the 4th of June, and it's a real high-end sort of action-packed. There's loads going on. It was a real joy to do. I play Mrs. Jones, who's in MI6, so yeah. I hope everyone enjoys it.
We all need a bit of binging. Vicky, just show us the message on your T-shirt briefly before we wrap up.
Oh, tea, please.
Tea, please. That's what we all need this time of day. Thanks both very much indeed for talking to us. Great to talk to you. Good luck.
Cheers. Thanks. Bye.
My next guest, Angela Rayner, romped home in the contest to be Labour's new deputy leader. Before becoming an MP, she worked as a care worker and for the trade union Unison before becoming an MP, as I said, and Jeremy Corbyn's shadow education secretary. Welcome, Angela Rayner. Good Good morning. Let me ask you, first of all, do you think schools should reopen in England on the 1st of June?
Well, I think it's really important that we recognise that schools are open, actually, and have been open throughout this whole crisis for vulnerable children and for children of frontline workers. So I think it's important that schools feel safe in introducing more pupils back into the classroom as quickly as possible. And I think what Gavin needs to do, the Education Secretary, is publish the science to why they're making the decision they're making now, and ensure that there is the testing and tracing, which he promised yesterday that on the 1st of June that will be available. But at the moment, we've not seen any evidence that they can provide that. They haven't got the staff in place that they said they needed to have the tracing. So testing and tracing and isolation is really important to tracking the virus.
And as you say, safety is everything. But have you seen any evidence at all that schools going back would be less safe for teachers and children? Because you know, you look around the world and there seems to be no outbreaks of COVID based on schools anywhere.
Well, we know that from the science and the experts that children can catch the virus, and we believe that they could transmit that virus. We're not entirely certain. So we have to make sure that obviously that the social distancing measures where possible are in place. We know that teachers have died as a result of catching COVID. So it's important that when we introduce more pupils into the classroom, that we're able to test, track and trace where the virus is and take action to isolate it. And that's important for wider as well, Andrew, as we ease the lockdown, because I believe we were too slow in taking lockdown decisions, and we've been too quick without the provisions in place to ease the lockdown, and it's really important to track that for the R8.
But this is all about how we measure risk individually and collectively. Anne Longfield, who was the Children's Commissioner for England, has pointed out that of the 62 nurseries in attached to NHS hospitals which were able to stay open, 60 had absolutely no COVID problems at all. In other words, and the ones where there were COVID problems were related to people coming into the nurseries, not the kids. So it seems that it's pretty safe for children to be mingling in nurseries or schools.
Well, I think if we've got the test and the tracking and tracing in place for schools, that would reassure parents. And Gavin Williamson, the Education Secretary, have said on the 1st of June that will happen. I want to see Gavin working with the parents to reassure them, publish the science behind why they're saying the 1st of June. We do want pupils to, as many pupils as possible, to go back into the classroom as quickly as possible. But we've got to reassure the teaching professionals who do want to see their pupils back in school as quickly as possible that it's safe to do so, and that we have the provisions in place to make that happen. And that means testing has to be there. We've seen in care homes what happens when you don't have that testing, and now we've seen the difficulties that care homes have faced.
Because on the other side of the equation in schools, a whole series of former Labour Education Secretaries, David Blunkett, Charles Clarke, Alan Johnson, have all said it's really, really damaging what's going on in terms of social divisions, kids left behind, inequalities, starting right at the early stages, is all being worsened quite fast by the fact that schools are not back already. And it's really, really urgent to get the schools back, and the unions should be backing that.
Well, it's important to recognise that teachers have been working throughout this process to get home learning. The education, the DFE department have been trying to ensure that home working is available. I think that's patchy. They need to increase that, because what we know is this virus isn't going away. We need a vaccine. So in the meantime, we need the testing regime. We need the support there for the hybrid model of some pupils being back at school when it's safe to do so, and others that are going to have to continue to work from home. And that the DFE and the government have to support the teachers and the professionals in doing the right thing and supporting their pupils. And I want to place on record my thanks, because we've seen the tremendous amount of work that teachers and teaching professionals have been doing to help our children over this period. And I think the DFE and the officials there have been working incredibly hard in extraordinary times. Now's the time for them to come together to reassure parents and to make sure that plan is in place.
So what's the Labour leadership's attitude to Labour councils like Liverpool and Hartlepool, which are saying we will not reopen schools on June the 1st? Do you back them?
Well, if you look at what Andy Burnham, the Greater Manchester Mayor, said in The Guardian last night, the communication from government in terms of the safety measures for areas like Greater Manchester, like Liverpool, like the North East, has been patchy, so the information hasn't been there. We believe the R rate is higher in those areas, in those regions, and therefore we want the government to publish the science behind it and to provide the support. So, for example, in Greater Manchester, we've seen that we had 12 hours notice for people to go back to work, and yet our transport system was not put in place to geared up to help people to do that safely, and guidance for workers wasn't there. So we've got to make sure that the Prime Minister and the government are working with our regions to ensure that they know that it's safe and that they've got the resources to support people going back to work and going back to school.
So for the time being, you support those councils in saying we will not reopen schools on the 1st of June?
I urge the government to publish the science and to ensure that the testing and tracing is in place to safeguard. Councils want to make sure that their citizens are safe. I support them in trying to do that. I urge the government to not make the mistakes they've made in the past and to publish the science and to give them the resources to make sure that we help people as much as possible to do the right thing to keep themselves safe.
Now, I mentioned at the beginning that you worked in a care home yourself before you became an MP, became a politician. How badly do you think we have let down care homes?
Oh, terribly badly. I mean, I think if you look at what the 26,000 deaths that were in April from the ONS figures, 18,000 of them are additional deaths from last year's figures. And therefore, we've seen also that the only ones that are related to COVID are 8,000. So there's 10,000 unaccounted for deaths within the care sector. There should be some investigation into that, and Keir Starmer has requested that, because every single death is tragic. And we've had medical experts, Andrew, who have said we seeded the virus into our care homes and the guidance wasn't there for care workers. I think they've been tragically let down.
They've been tragically let down, may I put it to you, by Labour governments as well as Conservative ones. This is a long-term problem, the ignoring of the care home sector, the underfunding of the care home sector. And in Wales, for instance, where Labour is in charge, we've seen exactly the same problems about the lack of testing in care homes. So this is something that both of the main parties at least have to share responsibility for.
Well, the national framework for the government and the guidance that was set out was totally inadequate. We allowed people to be discharged and the government were pushing to get people out of hospitals as quickly as possible without the testing. So as the medical expert said, we seeded the virus in care homes. Care home workers are not given the support that they needed to help. And they've been doing a tremendous job. Many of my ex-colleagues are not even paid the real living wage. Half of them are not paid the real living wage. So, and they're not even able to get statutory sick pay in many cases to do the right thing when they need to self-isolate. So the government has really let these care workers down and really let people down. They really do need to step up. Even the guidance now is saying that they won't have that testing regime in by the 6th of June. So they've really got to step up now. We've seen the devastating effects of what's happened because the government has failed to do that. They've got to go with the experts and they've got to provide the support. Our care workers cannot continue to be undervalued as they have been in the past.
Your former shadow cabinet colleague, Dawn Butler, said recently, I think the Prime Minister's actions are pretty disgraceful. He is literally sending people out to catch the virus. Do you agree with that? Or do you think Labour's been a little bit too aggressive in its response to the government recently?
Well, no, because Keir Starmer has been quite clear from the start that we wanted to be a constructive opposition. And honestly, Andrew, I really want them to succeed. I was working with the DfE when I was the Shadow Education Secretary, and I was working with Gavin to try and make sure that provisions were in place. And I think that's the absolute right thing to do. But we also have to call out when things are not done correctly.
Sure, but it's not exactly cooperative. It's not exactly constructive in the middle of a crisis to use that kind of language, is it?
Well, what Keir said, and he said at PM Hughes, was he made it absolutely clear, 26,000 deaths. 18,000 additional deaths this year from the ONS figures, 10,000 unaccounted for in care homes. That's something that is right to highlight and to ask people what's happened there, because those relatives deserve to know the answers to why their loved ones died, and to ensure that as we lift the restrictions, that the expert advice is followed and that it's published so people can have confidence in that.
All right. Angela Rayner, thanks very much indeed for coming in. Now, Dr. Soumya Swaminathan is the World Health Organization's chief scientist. She's also a paediatrician herself. And this week, the WHO announced we may have to live with this virus for 5 years or more. I began by asking her if we were facing long-term social changes as a result of that.
I think that's what we're all grappling with as people as well as governments. How do you get back to some degree of normalcy without allowing the virus to get the upper hand? So it's really maintaining that balance. And you have to look at a number of interventions to be put in place as people start going back to work, going back to schools. You know, families want to meet again. We want to go shopping. We want to have social events. But at the same time, we know now what is needed to keep this virus from spreading, the basic principles of maintaining physical distancing, of personal hygiene, respiratory etiquette, wearing masks when you're out in crowded places or staying home or sick, and so on. So that has to become the new normal. But I do believe that, society has to has to restart.
Has to restart.
Calibrated.
Now, you're the chief scientist, but I know in your own special area, you're a paediatrician as well. Can I ask you what the latest evidence is about children infecting each other?
Children don't seem to be getting severely ill from this infection. We do know that children are capable of getting the infection. So household studies have shown that when children live in a house where an adult has the infection, that they also have a risk of getting it just like the other adults. But there's less data on how effectively they're able to spread it to others. What we have seen in countries where schools have remained open is that there have not been big outbreaks in schools. And where there have been, it's been associated with events, where a lot of people gather, not in regular classrooms. And it's often been associated with an adult who's had the infection and who spread it. So it does seem, from what we know now, that children are less capable of spreading it, even if they get the infection, and certainly are at very low risk of getting ill from the disease. Now, very recently, there have been some reports of children getting admitted with a strange syndrome, an inflammatory syndrome, something that looks like sepsis, something that looks like a disease called Kawasaki's disease, which causes inflammation in the blood vessels. Now, it's not very clear what the links are between COVID-19 and this syndrome. There are some children who've tested positive for the virus and some who haven't. And so the WHO has discussed with a group of international pediatricians about how to approach this and the need really to collect more data on this syndrome and what's happening. So we've put out a note that just went up 2 days ago, which describes the case definitions of this syndrome and is requesting doctors to actually provide information in a standardized format so that we can quickly learn as much as possible about this syndrome. But again, to re-emphasize, the risks to children are extremely low with this infection, and there have not been many cases described of this of children transmitting it to others, particularly in the school settings.
Given all of that and the fact that some countries have reopened their schools already, is there any evidence from countries who have reopened schools or who have nurseries open and so forth, which lead governments still wondering about whether to open schools, to have any second thoughts or misgivings about opening schools?
I think overall the data have been fairly reassuring, though of course it's only a few countries that have done that. But I think, again, the guidance that has been put out by WHO clearly lays out the criteria that you would use when you consider whether to reopen a school or not. And very often it's based at the local level, at the community or at the city level, and is based on, of course, the epidemiology of the disease itself, whether it's still on the rise or whether it's under control and going down, and whether the measures that are needed to be put in place there's been enough time to do that in terms of, rearranging classrooms, making sure that there are hand washing facilities, that teachers are trained. And it's really important that, all the stakeholders in this, that is the teachers, the children themselves, and the parents or caregivers, have had a chance to have a dialogue and ask questions and be informed of what is being done to minimize the risks and what they need to do. Similar to what we were saying earlier, if children are sick, they should not go to school. Because I've talked to some people in schools who say, in practical terms, it's almost impossible to explain to particularly young children about social distancing. It just doesn't happen in schools. It's true, but in classrooms you can rearrange, the tables and chairs so that children have at least a 1 meter distance between them, and children learn. So hand washing, for example, of course, teachers would have to encourage and be a role model for children. And so many of these basic things, can be done, but then there also has to be a way of doing some kind of checks in school, of making sure that the infection isn't spreading. So that, again, is something that local governments have to consider as schools reopen. What is the data that one is going to monitor and look at in a real-time basis so that, you're keeping track of what's going on and you pick up anything before it really becomes unmanageable. Dr. Swaminathan, we're hearing a lot at the moment about new antibody tests. Is there any conclusive evidence that any of them actually work properly? We're still waiting for the longer-term data from people who've recovered from this illness. We know large majority of them develop antibodies. But how well it protects and for how long it protects from a second infection is something that we're not sure about at this point of time. But because of all the research that's going on, including research to develop vaccines, I think we will learn more and more in the coming weeks and months about these antibody responses. At the moment, its main use is really to check at the population level to see how many people have been exposed to the virus. So studies that have been done in many of the affected countries have shown that 5 to 10% of the population have been exposed to the virus in countries like Spain, Italy, Germany, New York State, and so on, which again tells us that the vast majority of people are still susceptible to this virus, and therefore we continue to need to be careful.
Finally, can I ask you about something there's been a lot of talk of in this country, which is the link between obesity and a serious effect from COVID-19. What do you know about that at the WHO?
Again, we're still finding out more about these risk factors, and we have seen that obesity and the associated non-communicable chronic diseases, obesity very often is associated with hypertension and diabetes in the same individual. And those, again, are sometimes associated with poverty, with lower access to healthcare, with living in overcrowded conditions. So many of these social and economic determinants of health go hand in hand, and all of them increase the risk for severe illness and mortality. So the data that's from many countries now shows that minority populations and those who